What about medical marijuana and kids? This is a great question. I'm a parent, I have 2 kids, and I take it very seriously. What we've found is that chronic, excessive smoking of cannabis is the most harmful. We're not sure what it does, but we have a pretty good idea it's not good for us. And we know this. Excessive use of anything is not good for us. But what about ailments? What about symptoms? What about diseases? Parents are finding that they have reduced the symptoms that their kids experience in diseases such as autoimmune diseases, Crohn's and diseases of the bowels, autism and epilepsy. Or if your child has a disease that's very extreme, there are very extreme drugs available. And sometimes the side effects of these drugs are worse than the ailment themselves. So cannabis can be a safer, softer alternative if done properly. A parent will use a tincture with their child. They'll give a couple drops of a cannabis-infused liquid to their child in the morning, which can help reduce symptoms without the high. They can help reduce anxiety, for example. It can help the child with ADD and ADHD symptoms of focus. Some kids experience PTSD, and PTSD is very common symptom relieved with cannabis. If you're going to address kids and symptoms with cannabis, the most important thing to remember is compare the readily available prescription drugs. Sometimes they're more severe, and cannabis can be tried very gently in a very conservative amount in order to reduce symptoms without having to increase medications that cause unwanted side effects.